This is a sterile specimen collection. I would come in, notify the patient, or make sure I have the right patient, and then notify them of the procedure we're about to do. And then you're gonna clamp off the tubing here. And then you're gonna leave this clamp for about 15 to 30 minutes, no longer than 30 minutes. Once you come back into the room and check on the tubing, once there's urine back into the tube, you can begin your sterile collection. You're going to take an alcohol swab and vigorously scrub for 15 seconds. Throw that, and then take my syringe and prime it. It's going to be a 10 cc syringe at 25 gauge, and then you're going to insert it at an angle. And then you're going to pull back however much was ordered on the physician's order. Pull it out. And unclamp the tubing. Specimen cup. Make sure you're keeping it sterile. Keep the cap facing down. And then you're going to slowly spray in the urine specimen into the cup without touching any of the edges. And then you're going to immediately recap the needle, throw it in the sharps container, cap your specimen lid, and then you're going to name, date, time, room number, and then send it to the lab within 15 to 30 minutes. Also, we're going to be doing a catheter removal. Again, you make sure you have the right patient, notify the patient of the procedure you're about to do, and then any questions or anything you need to answer for them. And then you're going to check your chart and make sure on the chart how many cc's they have inside the balloon that you need to remove before you take the catheter out. After you've checked that, you want to empty the collection bag and make sure all the urine is out, and then you can begin your removal. I want some tissues under here just in case any leakage comes out. And then you don't need to alcohol swab this port here, just insert it because you are de-seeing it. And then it should start coming out. And make sure you're holding this so it doesn't just slip out. Once you get out what was inserted into the balloon, in this case it was 10 cc's, you can let go of that and then slowly tell the patient to take a deep breath and then pull out. And then keep it facing upward. Make sure that the entire tubing is intact. Keep it upward. Dispose of everything in proper containers, and then document any urine output you took out of the bag before you started the procedure. Cover up the patient. Before you cover up the patient, actually, you're going to clean up the patient, any perineal cares that need to be done. Get as much of the betadine off as you can, and then cover the patient up and make them as comfortable as possible. And see if they need anything, put up the side rails, lower the bed, and keep the call light within reach.